Right, it's been about 4 years since COVID-19 wrought havoc on the United States and the world, for that matter. And while we're hopefully wiser now, at least some of us, you know that the old adage, those who don't learn from history are doomed to repeat it. Well, there's a new report out that reviewed the major policy errors and lessons learned during the COVID pandemic. Among the lessons learned, well, leaders should calm public fears, not stoke them. Lockdowns do not work. Masks were of little or of no value and possibly harmful. Any surprise there? Joining me now to discuss this and more is Dr. Bhattacharya, professor of health policy at Stanford University and one of the authors behind the 2020 Great Barrington Declaration, which advocated for an alternative approach from the government's heavy-handed approach to COVID. Dr. Bhattacharya, welcome back to Washington Watch.
Thank you for having me.
So I think the timing of this is pretty interesting, since also at the Supreme Court, and we're going to talk about this a little bit as well today, hearing oral arguments in a case from Missouri and Louisiana pushing back on the administration's censoring of critics of their COVID policy, of which you were one. And so now, after reading, skimming through a summary of this report, I know why they censored you. You were right and they were wrong.
I mean, it's striking to read the lessons in that report. It's actually hard to think of something the government really got right from the very start of the pandemic. So what was the infection fatality rate? Were everybody equally at risk of dying if they get infected? Is there immunity after COVID recovery? Are mass mandates an effective way of addressing the pandemic? Will the vaccine provide long-lasting immunity against infection and spreading the disease? Are there vaccine side effects? Will imposing mandates cause people to doubt the efficacy of other vaccines? On item after item after item, the government got it wrong. They absolutely got it wrong. And businesses closed, churches closed, people lost their they became depressed, and there are people that are dead today as a result of the government's mismanagement of the pandemic. And they censored critics in order to create an illusion consensus that they were right, and it was a lie. And so I think that's really the key, among the key lessons of the pandemic. There needs to be an honest discussion. Open First Amendment protects American health.
Going through the 10 recommendations that they make, the Committee to Unleash Prosperity that was behind this report, many of these things are items, in fact, almost every one of them are items you and I talked about during the pandemic itself, saying that we shouldn't be doing this. We ought to look at these alternatives. So, this is not like brain surgery. This is pretty common sense. Not only is it common sense, but it was the historical response to pandemics in most cases.
Yeah, it wasn't surprising that the government got these things wrong. If you look back over the past century, the way we've managed pandemics had been better focus on the people who are most at risk. Don't disrupt societies, because disrupting societies is bad for the health of people. Respect human rights during your pandemic response. Respect free speech, basic civil liberties. All of those kinds of don't panic the population. The idea that we could sort of wing it and come up with the right thing in order to just ignore a century of evidence and then suppress anyone who's criticizing you. I have no idea why the government thought that was going to work out, but it very clearly didn't. So many people lost their businesses. So many people, their kids became depressed, or they're up to 2 years behind in their schooling. Many people dropped out of school. There's huge numbers of people who skipped their cancer screening and now have late-stage cancer. We are in a bad place, and all we really needed was an honest discussion, and the government prevented that from happening with its censorship regime.
So let me ask you a question, Dr. Bhattacharya. I consider you a medical expert, okay? And one of the recommendations from this report was not to outsource decision-making to medical experts, to take the input, but the decisions needed to be made by the elected leaders, not outsourced to these medical experts. Do you agree with that?
I think that's a very wise thing, because I think a lot of times medical experts have blinders. They view everything through a narrow prism of how can I prevent the disease that I'm trained to prevent. But of course, health is broader than the prevention of a single disease, as we saw during the pandemic. The idea that you should have a group of people who are not trained to understand what learning loss does to children's lifetime well-being, who are not trained to understand how disruptions in our ability to worship impact our mental health, our spiritual health, who in many cases don't value anything outside of the prevention, the narrow prevention of the disease that they care about. They're not actually well equipped to make the kind of trade-off decisions that need to get made. Our elected leaders are also responsible to the public. If they make mistakes, they will get voted out of office. How will you vote Tony Fauci out of office? You can't do it. Right. So you have to have people who face the consequences of making the wrong decision. And unfortunately, what we learned during the pandemic is that so-called experts are not in any way held accountable. The people who got all of this stuff wrong that we just talked about, they're giving themselves awards, Tony. They're patting themselves on the back. When there's another pandemic, and there will be another pandemic at some point in our lives, we will do the same thing again because we've learned none of the lessons. And that's why I was sort of heartened by the report that we saw. That we've been discussing, because finally we're starting to see a discussion, an opening of the discussion that things did went poorly during the pandemic. We made huge mistakes, and so right now we need to reform our system so they never happen again.
And that's a part of the recommendations going forward, is that Congress take some actions to restrict the ability of governments to really trample upon fundamental freedoms and restrict the flow of information, which is critical to have those voices out there that the leadership, elected leadership, can hear from and then make totally informed decisions that take in the whole array of issues. Dr. Bhattacharya, always great to have you on the program. Thanks so much for joining us today.
Thank you, Tony.